Action.
Hello everyone, my name is Sue Ostertag. I'm clinical faculty with the School of Physical Therapy here at the University of Montana. I've been on campus almost 15 years and I very much appreciate the opportunity to come talk with you today about assistive devices and fitting assistive devices, and also a little bit about how pharmacy and physical therapy actually cross paths in this area. I think that you will be put in situations in outpatient clinics or even in hospital-based pharmacy clinics where you may be making recommendations for assistive devices. You also may run into situations where it's really obvious that the assistive device isn't the right one for that individual. And so I want to show you a few tips and tricks that you may be able to use to adjust and or help fit individuals with assistive devices. But then also, of course, I have to make a plug for my profession and recommend that you refer individuals to physical therapy if needed. If it looks like the assistive device is just wrong or they need more help than you can provide, don't hesitate to refer them to a local physical therapist or someone in the hospital. All right, so the goal of this lab today is for my daughter Brenna and I have some assistants here. My daughter Brenna is a med student with the WAMI program out of Bozeman. So she'll be helping me today, and we're going to show you a variety of assistive devices, how to perform different gait techniques, which ideally we'd have you practice, but due to the fact that we're all in a bit of social isolization right now with COVID-19, that makes it a little bit of a challenge. But we can at least demonstrate them for you. And then if you have questions as we go, please feel free to type them into the chat if you're using Zoom, or save your questions for the end, and we'll do a Q&A after the video runs. All right, so let's get started. So the first thing I'd like to do is show you some of the principles we use for fitting assistive device, whether it's a cane or a crutch or a walker. And two things that we rely on when we're fitting assistive devices: of course, the individual standing up nice and straight. Come this way just a touch. And the other thing we look at is the height of the wrist crease. And so you want to think about where that crease is, and we'll look at the height of a handle, for instance, with a cane to match up to that crease. When the individual has their hand on the cane, we look for about 20 to 30 degrees of elbow flexion, indicating to us that that's a good fit. So let's go through that with a variety of assistive devices. Amy, are we in a good spot?
Yep.
Okay. So first of all, with this type of cane, this is a small base quad cane. And you can see, again, we're super creative with the language. This is a large base quad cane and a small base quad cane. And as compared to just a single cane that wouldn't have this bottom, these have a little more stability, but they are cumbersome. And you can imagine that it slows down the individual's gait just a little bit when they're using them compared to either a single cane or no cane at all. We do recommend that when you use any type of cane with a base, that the flat side is flush up against the foot. And these do adjust by height. There is no left or right with these. You actually can just twirl them around to be able to fit them to the other side. So just a couple of points about these quad canes. So this particular quad cane, Brenna, let's go ahead and fit it to you. And so what I'd look at, having Brenna stand up nice and straight, is kind of the center point of this being 2 inches lateral and 4 inches forward of her little toe. So we look at fitting that, look at the height of her wrist, and when she puts her hand on the handle, we want 20 to 30 degrees of elbow flexion. So I actually think that looks pretty good. So let's go ahead and perform a gait technique. What I'll have Brenna do first is just a normal gait pattern. So let's say that her left leg is weak or tired, or excuse me, weak or painful. Then we want the cane opposite that leg. And what I'll have you do, Brenna, is put the cane and that left foot out at the same time while you're walking. Nice. And that's just, we think about that as, and document that as a step through gait pattern, meaning that one foot is stepping through to take the other step. Compared to a step 2 gait pattern, which I'll have Brenna demonstrate next. So with a step 2 gait pattern, the cane and the affected side go out together, and you think about that cane helping take about 5 to 10% of the weight, and then Brenna will just step up to the other foot. Thank you. Good work. All right, looks good. So those are the 2 most common patterns with the cane, and she could do that with this, with the wide base, or with a single point cane. All right, so canes, like I just briefly mentioned, canes can take about 5 to 10% of your body weight, but they are not meant to be fully weight bearing. So I refer to Fraser, if you're old enough to have watched Fraser, or even House, and that physician that was using the cane, first of all, on the wrong side, like this, and secondly, he was taking a ton of body weight on the cane. If you guys see individuals using canes that way, that is wrong, and hopefully you have the ability to teach them and or refer them to physical therapists so we can get them on the right track. Second thing I'd like to demonstrate is the use of crutches, or I'll have Brenna demonstrate it actually. And there's 2 different types of crutches. This one is called an axillary crutch or American crutch. And so with this particular crutch, we're still looking at fitting it the way we talked about with the cane. So if I take this point 2 inches lateral, 4 inches roughly speaking from her little toe, and I tuck it under her axillary area and have her stand up straight, what I'm looking for are 2 to 3 fingers of distance between her axillary surface and the crutch itself. And this should be a tight fit. The individual shouldn't be watching me or lifting their shoulders, because go ahead and look down as if you're watching me. The moment she does that, she becomes shorter. So she has to stand up straight. I can barely get 2 to 3 fingers in. And then we'll look at the wrist height, the wrist crease as well. And that's a pretty close match, so go ahead and put your hand on the handle. Then I'll look at that 20 to 30 degrees. So that looks like a good fit, Brenna. Let's go ahead and put these 2, make sure they're equal. Okay, so now what I'll have you demonstrate, Brenna, crutches can take more weight than the cane. So let's go ahead and make it a little more challenging. This is your practical exam, Brenna. So what I'm going to have you do is be non-weight bearing on one leg. And I want you to do a swing 2 gait pattern, meaning the crutches go out and then you hop right up to them, not past them. Yep, so that's a swing 2. The crutches are able to take full weight. Good. Come on back. So 2 other things that I remind our patients is this should not be a weight-bearing surface. All of your weight should be through the hand and palm, which, if this makes sense, one of the reasons I have 20 to 30 degrees here is so that when I step, I can push through my arms, make myself tall enough to clear my foot. So that's why that becomes really important. The other thing that I tell my patients is to squeeze their upper arms against their trunk, and that increases stability. But don't weight bear through this, okay? So swing 2 would be the more conservative gait. Now let's do a swing through, but please do not take big steps with your crutches. It should be a normal step length. So she's going to go non-weight bearing on one side and then swing past the crutches with a hop. Well done, Brenna. Good job. And pushing through your hands. Yep, you got it. Okay, so those are 2 of the more common ones with irregular crutches. The other gait that she did with the cane, she definitely could do a step 2 or step through with this as well. All right, let's take those. So those are American crutches. These are called Canadian crutches or loft strands or forearm crutches. And when we think about the use of these crutches, I want you to think about individuals that might need to use the crutches long term, like for the duration of the rest of their life. So 2 examples I commonly bring up would be an individual with incomplete spinal cord injury that has recovery maybe down to the knees, but has no use of the ankles or foot, and so they're in braces, they have no balance reactions, and they may rely on these for the rest of their life. The other patient population that uses these commonly would be individuals with cerebral palsy. And so I want you to think about, as we watch Brenda use these, why these may be recommended over the axillary crutches, and what some of the benefits and drawbacks are of these. So let's go ahead and fit her first. And so if you want to go ahead and put your arm in that, bring that point, how far out and how far lateral?
2 inches lateral and 4 inches forward from my pinky toe.
Good. And then bend your elbow for me, please. So that looks pretty good. Can you relax that arm? There we go. So it's a little awkward. That's what Brenna's finding, is it's having to put her arm back. We could bring this out a little further. Does it feel like it's too long?
No, it's fine.
No. Okay. So this also is adjustable. You want to make sure this is below the olecranon. We don't want to cause any nerve damage in that area. Okay, so Brenna, why don't we, these are also fully weight bearing. They're more unstable, as you can imagine, than the axillary crutches. So let's start with the super stable gait, the 2-point gait. And a 2-point gait means that she's going to take a crutch and the foot out at the same time. Opposite crutch, opposite foot. And this looks like a normal gait pattern as it smooths out. Very good. Come on back and let's do it faster. And then while you're watching her, I want you to think about why this is more stable than use of the axillary crutches. Good. Yep. There you go, nice. So go ahead and stand with the crutches. From a stability standpoint, what's happened is the crutches have given her 2 more points on the ground, and they've widened her base of support. So at any one point, at any one time, she has 2 points on the ground, which increases her stability with gait. The second gait technique I'll have Brenna demonstrate is not as fast, and it is more stable, and you can watch this and think about why it might be more stable. This is called a 4-point gait, and what I want you to do, Brenna, is only one device moves at a time. Crutch, foot, okay? Let's see. So you can see how slow this is and how safe it is. Easy to get off track, isn't it? Yeah. There, you got it. All right. So those are the different crutches. Like I said, we could have Brenna do the non-weight bearing swing to, swing through. I don't prefer those with the loft strands just because these are a little squirrely and more unstable. It definitely could happen. Last but not least, we have the walker, and I'll show you guys, this is a front-wheeled walker, and these are called skis on the back. You might see tennis balls, other little plastic doodads on the back. Their only goal is to decrease friction and protect the floor while someone uses the wheels in front to glide the walker. If it had just a regular plastic cap, it would be called a pickup walker, and those are a little bit more slow and cumbersome, as you can imagine. These are more commonly prescribed though. So again, the same rule, we don't really have the 4 inches forward, 2 inches lateral, but when she's standing inside the walker, I need to look at that handle being at the wrist height, which actually looks perfect. And then with her hand on the handle, about 20 to 30 degrees of elbow flexion. So let's go ahead and demonstrate. So here's the practical exam. Brenna, please demonstrate a swing to gait pattern. There we go. So she's non-weight bearing on one leg, swinging to the assistive device as she moves through. Good. Okay. Now how about a step through gait pattern? Step through. And that's step 2. Oh. Well done. So how would you progress that?
Oh, just this.
Exactly. So it's just normal gait.
Yeah.
But we have fancy words for it. It's called step through. All right. So one of the more odd gaits that you guys wouldn't see so often but are a little bit of fun would be a bilateral swing 2. So bilateral. So leave both feet on the ground and hop.
Do people actually do this?
Do it with your crutches. And think think about how fast it would be. So both crutches out, and then swing.
Oh, it's hard.
Yep, and swing past this time. There we go. That's what people do to go really fast. It's not necessarily safe.
It's hard.
Yeah, but so that one's odd. That's a bilateral swing through. All right, I think we've covered all of the assistive devices. One thing that we don't have here besides the single point cane is the rollator, or the bigger walker with brakes. And a couple of points about that. You can imagine that if this had 4 wheels, how swirly it would be and how quickly it would move and get out of control. So if someone doesn't have the ability to manage the brakes, then those 4-wheeled walkers are not indicated. The folks that benefit most from those are individuals that have endurance problems or cardiopulmonary conditions like COPD or CHF. And there's good literature out there to say that if those individuals have a rollator type walker, a 4-wheeled walker with a seat, and the brakes, that they actually engage in the community much more than they would otherwise. All right, so I think that's it for assistive devices. A couple more things I just want to show you that's really important is you guys will see these type of wheels for sale in the pharmacy or hospital, wherever you're at, or of course online too. Normally these walkers come with very small wheels, and those don't work very well 99% of the time. So individuals that are going to be outside at all, we really recommend these 5-inch wheels. So we often have to buy those separate. The other thing is there's parts on these crutches that need replaced on a regular basis. So you can see this black tape is probably not the best way to take care of this. So these come off, and then these can be purchased often in pharmacies. And again, if you see someone that has their crutch wrapped with tape and dish towels and sheepskin and all kinds of things, it means they're weight bearing on it and they're trying to pad it. And that means they're using the cane or the crutch incorrectly. So make sure that they've got the right surface on it and that they're not weight bearing fully. This is where they're supposed to weight bear, and so these also can be replaced. So those are 2 things to look at. The last thing I'd like to show you is this, and you have to try to figure out what it is. But while you're thinking about it, I want to remind you that there's a number of different adaptive type devices to assist people with being independent, such as long-handled bath equipment, like shower, the words are escaping me right now, but like shower brush. Is that the right word? Also long-handled equipment to assist with dressing. So dressing hooks, we have the reachers, and even long-handled shoe horns. So just keep that in mind when you're trying to provide some assistance for individuals to become more independent or advising them. This device, have you figured this out yet? Jean and I are quite confident that it's a leash for an invisible dog, but that's not it. So what it actually is a leg lifter. And so if I'm in bed and the only way I can get out of bed, let's say that I'm in bed and I can't move my legs independently, I can reach down and use this leg lifter to move my legs in and out of bed. And the most recent case that I have where this made quite a difference was a gentleman with COPD that used to sit on the edge of his bed in the middle of the night when he couldn't breathe well, and he couldn't get his legs back up into bed independently, so he would sleep on the edge of the bed instead of contacting his daughter. And so when we realized what was happening, we trained him how to use these. He actually had one on each side of his bed for whatever reason, but then he was able to get his legs into bed and not bother his daughter. So it made a huge difference in his life. And so anyway, this invisible dog walker comes in pretty handy. All right, so I think that's it. Thank you guys for your attention today. Please feel free to shoot me an email at any time if you have any questions or would like more information. That is susan.ostertag, ostertag, @umontana.edu. Thank you.